Hello, my name is McKenna Whitlow, and I will be performing an abdominal assessment on.
Brett Whitlow, and I consent to be recorded on video for this class.
Okay. We'll start off with a few questions. So, do you have any changes in your appetite? Any loss of appetite?
No.
What about any weight changes?
No.
Good. And then any difficulty swallowing?
No.
What about food intolerance?
Nope.
Do you have any abdominal pain?
I do not know.
What about any nausea, vomiting?
No.
What are your bowel habits? How often do you move your bowels?
Once a day or every couple days.
Okay. When you move your bowels, do you have any diarrhea or constipation?
No.
Is the color ever black or tarry?
No.
What about any abdominal history or surgeries?
I had a hernia surgery when I was a child.
Okay. And then are you on any medications regularly?
No.
What about alcohol use? How often do you use alcohol?
I have a couple drinks on the weekend.
Okay. So we'll start the physical assessment by assessing the abdomen. So I'm going to have you lift up your shirt. So when assessing the abdomen, I'm looking for a contour. His contour is a flat abdomen. I'm also looking for symmetry of the abdomen. I'm looking for any masses or bulges, which there are none. When I'm looking at his skin, I'm seeing that his skin is smooth. It's free from any striation or lesions. I'm gonna begin by auscultating. I'm gonna use my stethoscope and listen in all 4 quadrants. Normally you would listen for at least 5 minutes, but we're not gonna do that this time. Sorry if my stethoscope's a little cold. We're gonna start in the right lower quadrant. Right off the bat, I can hear bowel sounds that are regular. His bowel sounds are not hypoactive or hyperactive. I listen in the middle and I see that he is free from any abdominal bruits. I'll start with gentle percussion in all 4 quadrants. Listening for tympany. And then I will go and do gentle palpation, feeling for any masses, any tenderness or abdominal rigidity, which he has none. I move on to deep palpation. In the right upper quadrant, I'm looking to feel the liver. Take a deep breath in and back out. I massage deeper and deeper until I feel the borders of the liver, which is normal size. Then I move on to the the left upper quadrant and breathe out. I palpate deeper to see if I can feel the spleen. I do not feel the spleen, which is a normal finding. Normally you can't find the spleen unless it's 3 times its normal size. We go to the right lower quadrant in the flank area. Breathe in and breathe out. I'm palpating for the right kidney. You do have to palpate pretty deep to feel this. So I don't feel it. Take a deep breath. We'll do the same on the left. The left is usually 1 centimeter higher than the right. Palpate deep, making sure not to hurt the patient, but feeling for the kidney. And I do not feel the kidney, but that is a normal finding, especially for the left side. Do you have any discomfort or tenderness while palpating the abdomen?
No.
Great, and that concludes our assessment.